Radhe Radhe to all, and I hope everybody is doing perfectly fine. So, at the outset, I wish you all a very happy, healthy, and a prosperous new year. So, in short, today we'll be discussing about rule of three, and this rule of three is important where in our complete blood count reporting, the commonly known as your CBC. तो जब भी हम CBC टेस्ट के लिए जाते हैं, it's a blood test और CBC के सैंपल हम लेते हैं EDTA vial, okay, the lavender top colored vial. So in that you have EDTA as your anticoagulant. So in that you take sample for your CBC, complete blood count. So what when जब आपको report मिलती है, CBC report when you get, so you get hemoglobin, hematocrit, MCV, MCH, MCHC. In WBC you get all the WBC parameter, platelet parameters. So according to the machine, like staging, grading of machine, you get that type of those number of parameters. Like अगर 5 part है, 6 part है, so accordingly you get many parameters in it. So as the machine modernizes more, so it gives you more values. But the basic thing is rule of three. So what is the rule of three? It basically involves around your three parameters which we'll be discussing. So see, just know the importance of CBC. So I previously also had recorded lectures on CBC. I'll share it. So just see human blood. So it has human body. It has 5 liters of blood, correct? And even a drop of sample. You know how much sample is taken for your blood test. So little sample can reveal crucial information about various entities, disease. So rule of three, it's basically serves a key step. Basically you can say it's like a mental practice, like to have a clue about the working condition of machine, or is there any underlying condition, pathological condition going on in the patient. So what I will do is, I'll just show you one thing. So isme jo you have your three parameters. You have your RBC. If you multiply RBC by 3, you will get what? Hemoglobin. Hemoglobin में अगर आप 3 multiply करते हो तो amounts to your hematocrit. So RBC, you know it is in millions, right? तो अगर हमारा RBC 3 है, hemoglobin should be 9 and hematocrit should be 27. So this is rule of 3. So जब भी next time when you see your CBC report, just see these three parameters whether it is fitting or not. So this initially I am giving you. So it is basically what ये हमें एक वो clue देता है that our machine is working. So it's basically a quality control check in hematology stating that hemoglobin into 3, that is hematocrit. Hematocrit means what? अगर hemoglobin, अगर suppose hemoglobin हमारा 12 है, it means normal hemoglobin. Hematocrit अगर हम multiply by 3 होना चाहिए 36. So it is fair enough. So it is within range. So it gives you a clue that RBCs are normocytic, normochromic. So it basically verify your accuracy of RBC, hemoglobin and hematocrit. So RBC into 3 is your hemoglobin. Hemoglobin into 3 is your hematocrit. So this is how it goes. RBC, hemoglobin, hematocrit. Multiplying by 3, it gives the next result. So now what? अगर ये rule violate कर रहा है तो अगर if it is suppose RBC into 3 is not coming as your hemoglobin, or hemoglobin into 3 is not coming as your hematocrit. So where it occurs? So first thing हमेशा हमें जाना चाहिए जो major 3 तरह के errors होते हैं when we report hemat. Basically you have your pre-analytical errors, then you have analytical error. Pre-analytical is your collection, right? Collection है, naming of the sample, poorly mixing before you feed the sample to the machine. So all those are your pre-analytical error. Analytical error में आता है processing. और processing के बाद जो result interpret करते हैं, that is your post-analytical error. So the maximum error which occurs, it occurs in your pre-analytical phase. Correct? So इसमें जब हमारा rule of three violate करता है, the first condition would be your poor mixing of collected blood, right? या फिर कोएगुलेटेड ब्लड है या कुछ भी प्रॉब्लम आ रही है ब्लड में, फर्स्ट थिंग यू हैव टू रीसैम्पल, रीटेस्ट, बोथ थिंग यू कैन डू समथिंग, और मशीन एरर हो सकती है. सो यू नीड टू करेक्ट बोथ. इधर यू हैव टू मिक्स द ब्लड प्रॉपरली और you have to check your machine if it is the quality controls are going on correctly or not, or there are any calibration error. So all those things you have to remove and then go for your retesting. Check करने के बाद still after retesting, or you have fed another sample, resampling of the patient is being done, retesting is done, you have ruled out your pre-analytical error or machine error, then even if the rule is not followed, it means certain pathological condition is there in the patient. So it could be your iron deficiency or it could be hereditary spherocytosis. Maximum, when you see, just go and see one CBC form of iron deficiency individual, you will not get the rule of 3. Okay, or if there are target cells present, then also sometimes rule of 3 is violated. So there can be many error. Or pre-analytical error में अगर thick lipemic sample है with high triglyceride levels, then also sometimes this rule of 3 is not followed. So you have to check sample, you have to check your method of doing, you have to check your machine. Then you will end up in your giving a diagnosis of any pathological conditions. So it's basically, as I told you what it is, it's basically a quick mental check. जब भी अभी भी मेरे पास अगर कोई CBC form आता है, first I see rule of 3 is followed or not. Then I go into the detail of other parameters, right? And sometimes I see rule of 3, then I see MCVO, it is decreased, most probably iron deficiency anemia. Then we go for PS, and sometimes if you are interpreting it, then with the rule of 3 only you can go and advise your technician to make a blood smear. So basically it contextualizes your lab results and help in deciding the further investigation. And also one thing, ratio can also help you. If your hematocrit by hemoglobin ratio is more than 3, it means patient is having hypochromic RBCs, which is seen in your iron deficiency anemia, right? If the ratio of hematocrit to hemoglobin is less than 3, it will point to a conditions like your spherocytosis. So just see one parameter gives you so many different kinds of result. So this rule of 3, next time when you see your CBC result or CBC report, do check rule of 3, which states that RBC, which is in millions, if you multiply it by 3, it should amount to your hemoglobin, which is expressed in your grams per deciliter. And if you multiply your hemoglobin into 3, the result should, the hematocrit level, it should come to hematocrit. So hemoglobin into 3 should be equal to your hematocrit. So hematocrit is usually expressed in your percentage. So this rule of 3, if it is satisfied, you can be sure that yes, your machine is working fine. If this rule of 3 is not followed, go for checking your pre-analytical errors, machine errors, and then retest. If all those things are correct, go for retesting. Even if the retesting does not give you a concordant rule of 3 result, then you need to go for further investigation, like make a peripheral smear to confirm whether the patient is having any pathological conditions or not, like iron deficiency anemia or hereditary spherocytosis. So thank you so much for your patient hearing. Kindly like, subscribe and share my YouTube channel Patho with MK. Have a great day.